bunion is a deformity of the big toe. It's also called hallux valgus. In this deformity, the big toe deviates to the outside of the foot, causing a bump on the inside of the foot. That bump at the base of the big toe can be painful. Most commonly, we treat this without surgery. To treat it without surgery, we sometimes change shoe wear. We can modify existing shoes. Occasionally, we use orthotics and toe spacers. Rarely, the bump can be so painful and so deformed that it needs surgery. In those situations, the surgery that we most commonly perform is a cut along the distal metatarsal, just proximal to the big toe, and we shift the bone to realign the big toe. This also involves some soft tissue rearrangements, and to know exactly which kind of cut we need to make, we need x-rays and measurement of the angle of deformity. To know whether or not you have a bunion that needs to be treated with surgery or without surgery, please give us a call to come visit me at Kona. You can give us a call, and I'm happy to see you anytime.